Hello, welcome to 101nursing.com. I am your nurse Priscilla, and today we will be talking about multiple sclerosis. Multiple sclerosis is a chronic autoimmune disease that affects the myelin sheaths and conducting pathway of the central nervous system. It is the one of the most leading cause of neuro disabilities in young adults. This targets ages 20 to 40. Women are affected 2 times more than men, and a major risk factor for this disorder is genetic. First degree is parent or sibling, and that's the highest. You can get this through environmental factors, living in the northeastern part of the United States, such as the Great Lakes, the Pacific Northwest states, and Canada. Lack of vitamin D, smoking, and Epstein-Barr virus can make this a huge risk factor. So the quick patho of this disorder is inflammatory response resulting in just random patchy areas or plaque in the white matters of the cell. So that's causing damage of the myelin sheath and causing the thickness of that myelin to demyelinize or to decrease. So demyelinization. And that myelin is just the overcoat of the nerve within your brain. And the myelin also helps you, your electrochemical impulses to move faster. And it coats your spinal cord, it coats your brain, and this is major. So there are different types of phases, or different types of MS. For short, there's replenishing and relapsing and remitting, primary, secondary, prognosis, and progressive relapsing. Primary and secondary progressive. And it all depends on the month. So the relapse and remitting is just sometimes you can have it a few weeks out of the year, certain seasons, certain climates can trigger it. Primary progressive is just you get it from 40 to 60, and then you just continuously, there's no remission. Secondary prolapse, progressive, it's just been relapsing and remitting courses, just going back and forth. And then you're just continuously declining. Manifestations. This caricature really helps with manifestation of this disorder. Muscle weakness and spasticity, fatigue, tremors. It's really mask Parkinson's disease, numbness and tingling. You're going to have dyspnea, dyslopia, dysphagia, ataxia, and that's decreasing of your motor functions. How do you diagnose this disorder? There's no single test, but genetic testing is very important. If you have IgG bands within the myelin base of your protein, that can trigger it. You have the McDonald criteria also diagnoses. Yeah, actually the McDonald is like the one that takes the cake for that. But your primary goal for this disorder, medication-wise, is to treat the attacks. You're going to give them steroids, decrease inflammation, plasma pheresis, or plasma exchange, and that's plasma, it's exchange to help combat the severe symptoms of MS relapses. You have your beta interferons, you have various different types of medications to help, medication to help for fatigue. You have your baclofen to help with muscle spasticity. You have your antidepressant medications because this is really targeting the younger crowd, younger people. The goal for this is to prevent exacerbation, to manage symptoms and improve functions. You want plenty of rest, exercise, cool down, a balanced diet, and to decrease stress for this disorder. Thank you very much.